Welcome. This is the current trend section of our presentation. We are constantly updating this section to make it as current as possible. We know that trends are always changing, particularly these days with vaping. So we have so much information, we actually had to divide it up into two smaller sections. So this section is going to cover prescription pills and marijuana, and then the next video is going to cover vaping. So a big myth that we hear today is that prescription drugs are not as dangerous because they are prescribed by doctors. Unfortunately, this is not true. There's a great educational video that we have linked into the HyperDoc that the rest of this training is all on. So if you look under the next section on supplementary videos, there is a great video on prescription pills, and it has some personal testimonies on there that you can hear. We're going to go over 3 different classes of prescription drugs that are important for you guys to understand, and we're going to tell you what students get out of them, the effects, and the risks involved. So we'll start with opioids. So the purpose of opioids is to reduce the intensity of the pain signal in areas of the brain that control emotion. So you'll commonly hear things like Oxycontin, Percocet, Vicodin, and morphine. The reason that we're hearing students are using opioids are for the euphoria that they can get out of it. They get this natural high feeling. And then the risks are that there's severe respiratory depression, drowsiness, and a very high risk of depression. As far as central nervous system depressants, you might hear of things like Valium, Klonopin, Xanax, Ambien, Lunesta, Luminol. And the purpose of CNS depressants is that they slow the brain activity. So typically these are used for treating things like anxiety or sleep disorders, but our students are using them for the effect of getting that drowsy, calming feeling. So the risks involved are that they can become disoriented, lack of coordination, and it can also lead to shallow breathing, which is unfortunately something that can lead to death if it gets out of hand. The stimulant class is used to increase alertness, attention, and energy. It also elevates the blood pressure, heart rate, and respiration. And it increases the effects of dopamine and norepinephrine in your system. So it's typically going to be used to treat things like ADHD, narcolepsy, and occasionally depression. So Adderall is a really popular one that you're going to hear about that's specifically used for treating ADHD. Students often report feeling a euphoric experience, and unfortunately, the risks are that we often see students are really hostile, paranoid. They experience psychosis, high body temperatures, irregular heartbeat, cardiovascular failure, and seizures. So as you can see, if students that do not have a prescription for stimulants are using them, they can be very dangerous. We want to make you aware of a current trend called farm parties or skittling. So this is when students will come to a gathering of friends and they will bring any pills that they can get their hands on. They put them all on the table or all in a bowl, and then students will pass the bowl around and everyone grabs a handful of pills and ingests them, often combining it with alcohol. And it's kind of a Russian roulette game of you don't know what the effect of the pills is going to be on you because it's a random combination. So it might be harmless, or it might give you a high, or it could be lethal. So students, it seems, love the thrill of this, but it's, as you can tell, very dangerous. So this is called farm parties or skittling. A lot of you are probably wondering, where are the students obtaining these pills that they're bringing to the farm parties? So unfortunately, we know that they can get them from their own medicine cabinet. Often parents have prescriptions that are in there that they're maybe currently using or haven't used in a while but have just forgotten that they're there. Some of our students are very stealthy in the way that they take these medications. Sometimes they'll grab one pill at a time over a longer period of time, so it's not as obvious that there's pills missing. Other times, students will just steal an entire bottle. So this is something that parents can be keeping an eye out for. Primary care providers often will provide prescriptions. A lot of times we see that athletes are provided with painkillers, and then this can get out of hand. Emergency departments sometimes don't understand the whole background of a patient and will prescribe medication that's not appropriate. Internet pharmacists are a huge issue. There is a lot of internet pharmacists that are operating illegally and providing people with prescriptions that should not be getting those prescriptions. A good thing is that there is a lot of legislation happening right now to try to prosecute those people that are doing things illegally and trying to track them. And then friends that have prescriptions. So a lot of times we'll have students with ADHD that don't like the way their medication makes them feel. And so they will bring their medication to school and they will sell their medication to other students that want to use the Adderall to get high. This is a great website that can be really helpful. It's also linked into the HyperDoc that the rest of this training is on under additional resources. And basically what you can do is if you find a pill that is in your child's possession, you can go on this website, type in a description of it, and it can tell you exactly what that pill is. Marijuana is another big thing that we're seeing in our area. So a lot of you have probably noticed that the use of marijuana has really increased, and that's largely due to the fact that the perceived harm of marijuana has decreased. Students are asking all the time, if it's legal now, what's the big deal? Why are adults still making a big deal about us smoking weed? I like to preface this section by explaining, I know a lot of parents out there maybe have smoked weed themselves in the past when you were in high school or college. Unfortunately, cannabis in the 21st century is a whole new product. It's so much more potent, and it's getting more and more potent every day. Although cannabis does not kill brain cells, it does interfere with the hippocampus, which is the memory part of our brain. And so when a drug interferes with our hippocampus, it makes it really hard to retain new information and access old information. And this is why it's so harmful when we have students that are coming to school under the influence, because they're really not able to benefit from their education if they're not able to access the lessons from the day before and they're not able to store new information from the lesson that's being taught that day. We also know that having a high from marijuana messes with our dopamine. So dopamine is the chemical in your brain that tells you what you're interested in. So it helps us develop who we are. As teenagers, one of the biggest ways that students learn what they're passionate about is noticing what gives them the dopamine release, what gives them that rush of pleasure. And as we learn about what we like, this helps us to develop our identity. Unfortunately, when students are smoking weed, they are messing with this dopamine because they start experiencing this fake dopamine release, and over time, a real dopamine release is harder to get. And so we always explain to students that the more weed you smoke, the more delayed often your development of your identity is, because you lose track of what you really enjoy. We also know that young adults who use marijuana before 14 years of age are more than 5 times as likely to abuse drugs as an adult than those who first use marijuana at age 18. And this is why laws are working towards raising the age of when marijuana is legal. We've also seen a lot of psychotic or psychosis episodes that are starting to emerge, and that seems to be largely related to the increase in marijuana use. We also know that the use of marijuana during brain development can reduce IQ by 8 points. And lastly, marijuana is addictive. A lot of people will argue that it is not, but if you've provided treatment for someone that uses marijuana, you would see that as someone's tolerance level increases, they're needing to smoke more and more marijuana to meet their needs. We're also seeing a lot of students having withdrawal symptoms from marijuana. They are challenged to stop using, and they complain of headaches, they complain of depression. A lot of very solid withdrawal symptoms accompany when students stop using marijuana, which tells us that it does have an addictive quality about it. These are some pictures of what marijuana can look like. It comes in a lot of different forms right now. So the top left picture is your traditional marijuana bud that would be smoked. The top right picture is something called butane hash oil. It can also be called butter, shatter, or wax. And when students smoke this wax, it's called dabbing. So there's dabbing, the dance move, but students, if they're talking about dabbing, they could also be referring to this form of marijuana, and it is much more potent. It actually is possible to overdose on butane hash oil. And the way that the butane hash oil is made is a very dangerous process as well, because they're using butane oil to suck out all of the most potent oils in the marijuana, and then they're just smoking that part. So what might take someone a full blunt of marijuana to get high on, they might take 2 hits of wax and they could be the same level of high because it's just so much more potent. There's also a lot of edibles out there right now. So on the bottom left, you see some gummy bears, and on the bottom right, you see some cookies. So what's really dangerous about these is that the serving size throws you off a lot, and students are not attentive to serving size. So the serving size for a weed gummy is like the head of the gummy or the foot of the gummy, and the serving size for a cookie is like a quarter of the cookie. But students are not looking at that, and it also takes longer for the high to set in with an edible. So they might eat a whole gummy, not understanding that that's not the accurate serving size, and then they wait like 5 minutes and they're not feeling high yet, so they think it's not working, so they take 2 more gummies. And so then at that point, they're drastically increasing the amount of marijuana in their system, and overdose is possible at this point. These are some drug apparatuses to keep an eye out for. So on the top left, you have a traditional bong. The top right, you have a pipe. The bottom left, you have a vape pen, which we'll talk more about in the next section, but vape pens can hold marijuana in the oil form. And then on the bottom right is just a traditional blunt. So if you see this brown paper in your child's room or amongst their belongings, it might mean that either they had a blunt that they emptied out or they have the paper and are preparing to roll a blunt lighter. Stay tuned for our next section on vaping. If you go back to the HyperDoc link that this training came from, you'll be able to access the next video on vaping.